Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
Good morning, Beth.
Hey, how's it going?
Oh, just dandy. We just got back from California. Had a good trip.
Yeah, was it good?
Yes.
Awesome. You look well rested.
Yeah, debatable. Great. I'm putting on the perfect front then.
You have your caffeine ready?
Yes.
Yeah, that's funny.
Yeah.
Well, good.
You guys, the family's been healthy?
Yeah, everybody's been good. I know. Can you believe it? I'm surprised because we have not had, knock on wood, any illness so far this winter. And usually that's kind of when it rears its head. How about you guys?
Right. Oh, yeah, we've been really excellent. You know, considering we're in the middle of a pandemic, it's very surprising that
I know
the health of our family. So
I keep waiting.
Knock on wood.
Right. I keep waiting for the shoe to drop, right?
Yeah.
But yeah, no, we haven't had the flu and we haven't had any other illness at all. So hopefully
maybe that goes to show the work that we're doing on ourselves is
there you go.
Off. Yeah.
Let's tell ourselves that.
Yeah.
Have you ever, we're going to be talking about chemo today, right?
Yep.
Have you ever felt any illness as close to the side effects that you felt from chemo?
No, but I also didn't feel awful on chemo.
I know, you said that.
Yeah, but it's like a feeling that you can't really describe because it doesn't compare to anything
else.
Like I want to say, I think I envisioned it feeling like nausea from pregnancy or just like feeling blah, which I feel like you also feel like in pregnancy. But I felt like I had moments of the most energy of my life, but at the same time,
steroids.
Hello steroids. I remember being up till like 1 or 2 o'clock in the morning, being like, I have to go to bed. How do I physically shut my engine off? But at the same time, also just feeling like drained and depleted. And
I remember calling it Steroid Fridays because I would get treatments on Thursdays, which is when they would give me those steroids. And then Friday, I felt like $1,000,000. So it was kind of counterintuitive. You think you're going to feel really awful. And then for me anyway, that next day was when I got everything done. And the steroids were my favorite part of treatment.
Really?
Did you gain weight?
Maybe, the mental part of steroids was hard for me because all I did was crave like pizza and toast with butter and things that I did not like to eat. And mentally I was going, you shouldn't eat this. You shouldn't eat this. You shouldn't eat this. But it like feels so good.
I was the thinnest I ever was on when I was going through chemo. And that was another benefit. I was like, this is great. I haven't been this thin since high school. Now my husband was like, I can feel your butt bones. This is gross.
Yeah.
Like he did not like it at all.
But you were also sick though, right?
What, with chemo?
Yeah.
Yeah. Oh, yeah. So I think
there's the other side of that coin.
But I wasn't nauseous. It's just I didn't have an appetite, I actually felt really good for half a chemo. Let's get into it.
Okay.
Let's talk about it.
Yeah.
So let's tell everybody
what excited here.
I know. Well, chemo is a big deal. A lot of women are just incredibly fearful of what chemo is going to be like. So I hope that today is going to be helpful in terms of what our expectations were. And so what are we going to talk about today?
So we're going to talk about getting a port. You got a port. I didn't get a port. So we're going to kind of go through what we went through with those and what we know about it. And then we'll talk about chemo fears, some of the fears you had, I had, and what else?
Let's just talk about what chemo was like for each of us for both of us, because you kind of coasted through and felt pretty good. I also did well with chemo, but you had 4 treatments. I had 16. And
so,
I wasn't doing as well as you were, let's say that, but it wasn't as bad as I had built up in my head. So let's just talk about all that.
Yeah, let's do that. But before we do that, let's hear from our first sponsor.
Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at paxmanscalpcooling.com. That's paxmanscalpcooling.com.
And we are back. So it's kind of awesome that Paxman is our sponsor right now with us talking about chemo.
And hair loss.
And hair loss. Yeah, that was actually a large consideration of mine before I went into chemo, but I think we have talked about that in previous episodes. So go back and listen to that if you're curious about what that was like.
Right. Yeah. Yeah, because losing your hair was a big trauma for you.
Yeah, for sure.
Yeah.
For sure.
For me, it wasn't quite as bad, but
yeah.
Every woman's different. So for some people, their biggest fear is the loss of hair. So yeah, if that's you, then definitely pay attention to Paxman. Maybe they can help you retain most of your hair through treatment.
Yeah. So what was, Beth, tell me, because and I'll share this in a little while, but I didn't end up getting a port. What kind of went into your doctor and your provider's decision on getting a port, and what was that like?
All right, so let's start with what a port is.
Oh, yeah, great place to start.
Okay, because I wasn't sure what a port was, but what it really is a small implantable disc that has like a thin tube attached to it, and they attach it to a vein under the skin. So the main advantage is that chemo meds can be delivered directly into the port rather than a vein in your arm, which eliminates the need for needle sticks. They told me at one of my visits, they said, okay, here's the date that you're going to get your port put in. They didn't give me an option. They didn't tell me I had an option, probably because I had 16 chemos coming, and I think it would have destroyed my veins, if I would have gotten an IV each time. So it was just, hey, you're going to have a port put in. Here's the date of it. This is what's funny about this. So I just thought it was going to be a real simple outpatient procedure. They go in, I don't know what I expected. So I had been talking to a friend who was a nurse, and I said, she asked what I was doing on Tuesday. And I said, I'm getting my port put in. But I said, after I get done with that, you want to go shopping? And she's like, Beth, do you know what this is? This is a surgical procedure. You're not going to be able to go shopping. I had no clue. Yeah.
Earth to Beth.
Right. Yeah. As is me, I had no clue that this was, an actual procedure where I was going to be under anesthesia. So that's what they do. They usually place it on the chest wall. They make an incision that's like 3 centimeters in the skin on the front of the chest. And then they make a pocket like under the skin for the port to be inserted. And then the tube, like the catheter, is fed through the vein until the tip of the catheter is sitting in one of the large veins in your chest. And then basically they put the tube to the port and your vein, and they access your vein through that disc.
Gosh, that sounds so complicated.
Doesn't it? So, okay, It looks like a quarter under your skin.
Yeah.
It looks like a quarter under your skin, and they basically just put the needle on that quarter rather than having to access a vein. Does that make sense?
When you go in, so it's from what it sounds like, it's not like lack of needles. You still get poked, but basically they go right into
like this quarter versus having to find a vein.
Yeah.
Because the vein's already been accessed. So it's under the skin. You can't see it. So when you and what they do is, I think it's like general anesthesia, and they kind of put you, I think they do it in the x-ray room. And I mean, I was aware of what was happening, but I couldn't feel, and I was very loopy.
So your eyes were open while this was happening?
No, because drugs work really well for me. but I was aware. I could hear them talking over me. I could it's kind of like getting a tooth pulled, right? You feel some pressure.
Yeah.
You can feel them working on you, but you're not in pain. It's not painful. You're just kind of out of it as they do it. But yeah, when you wake up, you've got like this, what looks like kind of this quarter, and you can see it. It's a perfect circle underneath your chest. But when they access it with a needle, I think the needle kind of looks like a nail. I mean,
oh my gosh.
It's thick. It's thick.
But it doesn't hurt.
Oh, no, it hurts.
Oh.
I don't know if I should say that. Yeah. So, I mean,
yikes.
So, I know, right? Now I'm scaring people. So, it depends on who your nurse is, because I would start to look forward to it depended on what nurse you got.
Yeah.
So if I got this one guy, I knew that I was going to be in and out and it wasn't going to hurt at all. And then if I got somebody else, I'd be like, oh no.
Yeah.
They will allow you to numb it. But to be honest with you, I've never been a fan of that numbing gel. I just don't think it works that much. Yes. So I just used to say I'd forego the gel and just have them do it.
Interesting.
Yeah.
Okay.
But it does save your veins.
Yeah. I mean, I was kind of picturing, you get this and now if you have a fear of needles, that's kind of like gone. And I remember going in for my very first fill injection with my implants and being so freaked out that it would hurt, and then it didn't hurt at all. So it's interesting to hear that there is lots of...
I mean, it's not pleasant. I'm not going to lie about it. And it really does depend on the nurse that you get. But I equate it to like taking a thumbtack and pushing it into your skin.
Well, I mean, so
I'm freaking people out.
I know for anybody, I guess it's great that you're sharing the real. For anybody though, I think about sometimes there have been times I have really easy veins to access. They're pretty like, I'm translucent. I have very white skin. So my veins, you can see them. And I have had people who have a hard time getting IVs in on me. So at least with a port, it's like you're guaranteed one stick and you're done instead of, hopefully, the hope is. But with an IV, I feel like there's a lot that could go wrong. You could miss the vein. You could blow the vein. You could have to do the other arm. You could get 2 or 3 sticks per.
Yeah.
So.
Well, I think that's the idea is that it's supposed to be easier on your, on your body. And they're very good at it. They do it very quickly. It's not something that's just, going on and on and on. It's a stick and then it's done and you're fine.
Yeah.
But yeah, it's more involved than I guess I had imagined. So that is what it is. Are you glad that you got IVs versus a port?
Well, now that I'm hearing about your port experience, yeah.
I have a high pain threshold, so I didn't think it was that big of a deal. I mean, clearly, I didn't use the gel.
Yeah.
So let me say that. I did not use the gel, people. I did not numb the area.
Yeah. I think it's all part of the... Beth is also the one who has now talked me into not getting the lidocaine when I get my monthly Zoladex injection, which is like a pellet insert. So I think it's all part of the growth. Like, I'm just trying to be a BA about things.
For me, it's all about efficiency. It's not about trying to prove something.
Yeah.
It's about, it shaves like 5 minutes off of being in the chair, 5 to 10 minutes off the chair.
True.
So I get out 10 minutes earlier if I don't numb first.
Yeah.
So for me, it's all about getting in and getting out and not being stuck there.
Yes,
so
I get that.
So
I only had 4 chemos, and because my veins were easy to access and because I only had 4, I ended up having the IV, and we were actually doing a little bit of research offline about the difference between a PICC line and an IV, which I still think we're a little bit confused about. So maybe somebody out there, a nurse, can clear that up for us. But what we found was potentially a PICC line stays in. And because I had 3 weeks in between each treatment, I just had an IV every time, which was just a needle. So it wasn't like the plastic catheter kind of IV, which freaked me out because I was still a little needle phobic. But by the 4th one, which was actually the one where they had to stick me 4 times and call over the Beyonce of needle pokes. I didn't find it to be terribly, it wasn't uncomfortable. It was fine. And I was glad to not have an extra scar and have an extra procedure. So the 4 was actually fine with me.
Yeah.
Having it that way. But the downside of it is, and I don't know, it's like chicken before the egg. Did this come because of some other reason or because I had chemo in general? Now, every single time when I have an IV, when I've gone in for all my surgeries post chemo, I get phlebitis, I think it is. Or thrombophlebitis. It's my arteries, wherever I have my IV, swell and get really hard and very painful. So my last surgery... and it happened both times I had surgery. My last surgery, they had to put my IV on the thumb side of my left hand. And it hurt so bad just to drive my car, to move my wrist, because it gets it's hard and you can feel it. And when you touch it, it's just it's knock you on the knees painful.
Really?
So I don't know if that came because of chemo and because I had it that way. I don't know. But
so are you pro port now?
I don't know if I had to go back and do it the other way. I mean, I don't know what I would do. I think it would depend greatly on how many treatments I was getting and is that the price to pay to not have a scar on my. I mean, how many IVs am I getting? I'm not getting a ton anymore, so it's not huge. It is painful when I get it, and it's kind of a frustration.
See my scar right there? Can you see it?
A tiny bit. Yours is really, oh yeah. It's right on your clavicle. So it's right on your collarbone. Yeah.
No. It's a little bit down from there, but yeah, you can see that there.
Yeah.
It's not too bad.
No, it's not bad at all.
If I had it lasered by a dermatologist, you wouldn't even see it.
No. I was actually bartending a party on New Year's Eve, and a girl came up and I saw hers and I was like, oh, is that a port scar? It was kind of a cool moment of,
it's like
I know what's up. Yeah.
Your battle sign.
Your battle scars. You know, guys talk about that all the time.
Yeah. There you
Chicks dig those.
That's funny.
Yeah.
Oh, gosh. Okay. So that is it. That was our experience with port versus no port. I don't want to scare anybody. It's really not that big of a deal.
Yeah.
But it
you
is.
should be aware.
It is what it is, right? It's just one of the things. So, you know what I think before we continue to talk about just chemo, do you want to do boobs in the news?
Yeah, let's do it.
Let's do it. I need some little levity after the port talk.
Yeah, so Boobs in the News is a fun segment where we read funny tweets from real people or ridiculous news stories.
Boobs in the news, boobs in the news, boobs in the news.
Okay, so this happened about a week ago. So it says, welcome to a whole new level of drunken regret.
Oh, boy.
So a 30-year-old guy in England got super drunk on Christmas Eve and decided to legally change his name from Thomas Dodd to, drumroll, Celine Dion.
He must really like her music.
So apparently he was watching Celine on TV at the time, filled out the online application, paid the $120 fee, and then passed out and forgot all about it.
Oh, no.
So he didn't realize what he had done until he got the papers in the mail certifying his name change. So, yeah, that's what happens when you're watching Celine Dion drunk on Christmas Eve by yourself.
I didn't realize it was so easy.
Well, that's what I was going to say, is why are we making it that easy for people to change their name?
They're just asking for drunken people to do this all the time.
It's just more tax dollars, right? $120 and, a quick little application and you can be Celine Dion. So what's funny about this is that he says he's planning on keeping the name. Depending on how difficult it makes his life. And this is from the Daily Dumbass, and they go on record as saying, I'm going to go out on a limb and guess it's going to make his life very difficult.
Yeah. You're hired for a singing gig.
Right.
Hope he's got that range that Celine Dion does.
I was just going to say, maybe he's going to get all the perks, right?
Maybe.
Like he can just, start getting the best rooms.
Yes. It's okay. Put it on my tab.
Yeah. But if you had to change your name, what would you change it to?
Oh, gosh, you're putting me on the spot.
Well, do you like your name?
Yeah.
I like my name, too. Some people really don't like their own names.
Oh, yeah. No, I mean, I have a pretty generic name, and I think it's easy to fill out on a Scantron. I like that.
What's a Scantron?
What? You had to fill in those bubbles when you take tests in college? Yeah, it was like Sarah Hall. Easy.
Oh, that's funny.
I didn't have some long name that took all the bubbles.
That's true. My my maiden name used to be longer, and then my grandparents got tired of writing it on checks, and so they shortened it legally because they got tired of writing it.
That feels like a lot of work. I mean, think all the things you have to change.
Hello. I was sitting there thinking, I'm wondering though if that's where I get my efficiency streak from.
Oh, maybe.
Because I'm all about efficiency.
Wow, I didn't know efficiency was genetic.
I don't know. There you go, guys. That's our boobs in the news for today.
Boobs in the news, boobs in the news, boobs in the news.
And we're back. So let's talk about our fears we had regarding chemo. Were you scared?
Yes. I fully expected to be in the bathroom and throwing up.
Hugging the toilet like in the movies.
Awful. Yeah. Yeah. And we've talked about this in previous episodes where I prepared for the absolute worst.
Yeah.
And
you
Googled everything and looked up on all my Facebook groups, like who had this drug and how did you feel, and read through all the comments and prepared myself for the worst.
Yeah. Don't do that. We're going to say that again. Don't do that. Are you okay?
I feel like, I'm, everybody is going to be different. Do your thing. But I think what was the best part about it is that first 48 hours, that next day you're kind of wearing off the steroids and you're still on them. And And then after that, I was waiting, just like you said, like for the shoe to drop. Like, okay, at any moment, I'm going to start to feel nauseous and I'm going to feel bad.
What drug was it? Do you remember?
Oh my gosh. I had Cytoxin.
Okay, so you had the Taxol.
And Taxotere.
Okay.
Yeah.
So it was a taxane, like a Taxol.
Yeah.
That was so that's, okay.
Yeah.
So I had AC, which is what doctors and patients call the red devil.
Right. I've heard of this one.
And then I had, so that was 4 of those. And then I had 12 of what you had, like the Taxol.
Okay. And the red devil made you feel yucky?
The red devil was, yes. And the Taxol was like doable, kind of what you said.
Gotcha.
So I understand why you're saying that it wasn't as bad as you thought, because the Taxol in comparison to the red devil was a cakewalk.
Yeah.
So I do think that people have these misperceptions about what it's going to be like. My life more or less resumed to normal when I went on the Taxol.
Yeah.
So I think that's it should be encouraging to people that if you have to take the AC, it is a little bit different.
Yeah. You get the hard stuff done before.
Yeah.
And then
Which I tell people all the time when they're in the middle of the AC and they're just like, I can't keep doing this. I tell them, when you switch to Taxol, it's going to be glorious. It's just gonna be so much better. You're gonna be so ecstatic.
Yeah.
And so thankfully the AC is not, you don't have to do it very long. For me it was 4 sessions every 2 weeks, because it will take you pretty much of those 2 weeks to recover.
Yeah.
I don't know. I wasn't super scared because I didn't Google. So I didn't Google. I didn't go online. I didn't ask anybody what their experiences were, because I realized that every person's different and how they respond to things is different. And so I just thought, what's the point of me looking at this when it may not be me? So.
Ironically, my mentor at the time, who had the exact same breast cancer as me, had the exact same drugs as me. She was telling me about her experience. So I had that to go on as well. And I think what gave me hope was she would say, I'd have a week where it wasn't great. And then the next 2 weeks, because they were 3 weeks apart, the next 2 weeks was fine. And then you get to go back in and do it all over again. So, you
have time to recover.
Yeah, you know what to expect after that first one.
Right.
And then
I think it's the first one, which I don't know if you remember how you felt with my first one. We had different chemos, but mine was strange. Like, it was really strange.
So I feel like I have to tell this story. It's so funny. And I'm sure if this nurse ever listens to this, she will know how much she kind of like eased the fears. So I got 2 drugs every single time. And the first one took an hour to infuse and the second one took 45 minutes to infuse. With my second one, I hope it's okay that I share this, but she said she's like hooking it up and they usually do like a saline flush in between. And she's telling me this as she's like, okay, we got 15 minutes to like let the saline flush through and then we'll do this and then we'll hook up the second drug. And she gets down and she like whispers into my ear. She's like, just so you know, some women, they experience an orgasm on this drug. And I was like,
How did you get all the cool doctors?
I sat back in my chair and I was like, what will I do? Like, how will I keep that to myself? And so the entirety of the 45 minutes, luckily my husband was there with me and like he was the only other one. I was just like, I was waiting.
Did you tell Eric what she said?
Oh yeah, for sure. I was like, okay, so this might happen. And like, I think a music therapist came by and played us a song and I'm going, if that happens while she's here, what will I do? And the whole time I'm thinking it's going to happen. And then it gets done and I go, I guess I wasn't one of the lucky ones. And so she comes to unhook me. And I go, so that didn't happen to me. And she was like, oh, honey, I was just kidding. Well, you completely changed the way that I experienced my first chemo. And then I never forgot. I mean, obviously, I will never forget that. But,
oh my God.
But I don't know.
I will say that's funny on so many different levels. I love that nurse. I just think good for you. But I also think it's a good point to make for people that while you're getting the infusion, you're not going to feel any different.
No.
You don't feel different during the infusion. It's not until later that the side effects, the side effects go in.
Yes.
So that is hysterical.
Yeah, she was cool. I also brought her pink Starburst every time because, then she was obviously my favorite and I had to reward her. So.
I had a favorite nurse too. She'd always grab me the best magazines.
Yeah.
So everybody's got that favorite nurse. So if you're a nurse, be that nurse. Be the nurse that the patient remembers, because you just go above and beyond and just bring a little levity or, to the situation.
Yeah.
Yeah. So on my first infusion, I finished at 8:00 because when I went in for it.
You finished at 8:00. What time did you get there?
Well, I went in at a normal time, I think at 2, and they couldn't find my order. But so I go to check in, and I sit down, and 2 hours goes by. I'm in the waiting room. I'm seeing everybody else go in. I'm sitting there for 2 hours. So I go up to the counter, and I asked the receptionist, I said, hey, I've been sitting here for 2 hours. My name's Beth. And she's like, okay, I'll check into it and see what's going on. So I was like, okay. And I sat back down. My mom went with me to my first one. I sat back down, and I didn't know about it, but she left for the day. The receptionist left for the day. So I don't know if she didn't check, but she left for the day. So I sat like another 2 hours.
Oh my goodness.
Before somebody realized I was sitting there and asked me about it. And then they said, oh, we don't have an order for you. So then it was a question of, we might have to send you home and you may not even get this. Well, we had, geared up, emotionally to have this first chemo. And then we were being told, like, you might not get it. So we waited another 30 minutes, and the nurses tracked down the doctor, got the order, and we proceeded. But I didn't get home until 8 p.m. So the actual infusion went off without a hitch. Like, you don't feel any different when you're getting it. I felt totally fine when I got home. I went home, and I remember I had 2 chicken salad sandwiches before bed. I was eating
those steroids.
Right. And then I fell asleep around 11 p.m. And I think they had told me that, we probably I wouldn't feel anything for 24 hours or whatever. But I woke up at almost 2 a.m. and I felt weird, like really weird. And the first thing I noticed was that it felt like I was wearing a really thick second skin.
Oh, yes. I do remember you telling me about this. This is interesting.
I can't, that's the only way I know how to explain the sensation. It was the strangest thing ever. And I've never met anybody else that has said the same. It was really odd. And I had a twinge of nausea, like, that felt more pronounced when my eyes were closed. And I felt like I had to, my head felt heavy. I felt like I had to go to the bathroom, but I couldn't. And then I felt the urge to drink something warm. So I went downstairs and heated up some vegetable broth and took it back upstairs to my room and sat in the recliner and just it was strange because these symptoms are happening and there's nothing you can do to really mitigate them. Because that's the thing about chemo. It's not like you have a headache and you take Excedrin, or you know what I mean?
Yeah.
It whatever you're feeling, you just got to feel it.
Yeah.
And so as I'm sitting there in the dark and my husband's snoring next to me, and I thought, well, I'm not going to wake him up because so far it's okay. And I just would document the symptoms as they were happening. It was just really odd.
Yeah.
And then it progressively got stronger and stronger, and then it hit me pretty hardcore. And the AC is difficult. It's a difficult chemo, and you spend a lot of time in bed when you first hit, and then you kind of crawl your way back out.
So it hit you roughly about 8 hours after?
Yeah, and they told me it usually sets in 24 to 48 after.
Oh, okay. Gotcha.
So, for me, and that's
quick.
it was quick.
You say drugs hit you pretty hard.
Apparently.
So, yeah.
In every circumstance, I feel them pretty heavily. So, I was experiencing that really early. I had a slight headache. But it was interesting. And so I had 4 of those. And each one, I think people should know, the more you get, the more, fatigue and just kind of you feel.
So with my second infusion, I didn't really have any other... Obviously, just like you said, fatigue hit me more with every one, but never to the point where I was like, I cannot function. But the only other, I guess, hiccup to say happened at my second one. I thought, I got this. It's in the bag. Like, it'll be just like last time. Like, everything was fine. My husband had just left. He went to go do something. And my friend was sitting there with me. And I had just started my first, the Taxotere. And I was trying to play it cool because, like, all of a sudden it felt like an elephant was on my chest. And I got this extreme pain in my back, like someone was stabbing me, and I flushed with hotness. And I was trying to keep, when you have, like, even when you're, like, embarrassed about something and you try to keep it together and you're trying to hold it together, but I couldn't anymore. And the nurse looked at me and she knew immediately what was happening. And I go, what is wrong with me? And she yells out, get the crash box.
Stop.
And I'm like, what's happening? You have to talk to me. I'm not one of those people that doesn't want to know. I want to know what's going on with my body. Right. Well, apparently with the Taxotere specifically, there's a large chance that the second time you get it, your body will do what it does the first time with it. And then the second time it will have a reaction to it. And it happens a lot because she lingered. I noticed she lingered close to me when they started that infusion and was right there when it happened. And after the fact, she said, this happens a lot. And I said, okay, well, I'm not one of those people that doesn't want to know when those things are coming. Tell me if something might happen.
I would have wanted to be surprised.
Oh, no. Because then I could have said something sooner instead of just pushing it down and pushing it down like everything will be fine. But I guess your body has this massive allergic reaction. So then they dumped a ton of Benadryl into me, which, then after that, I took a nap, I think, the rest of my
wiped you out.
It wiped me out, but it was surprising, and I wish I had known about it. So for everyone out there who likes surprises, don't listen to this episode, or sorry, too late. Spoiler alert.
No, I mean, it would have been fine if they would have said, hey, we've talked about that. I say I would have liked to have been, I would not have liked to have been surprised by that. I'm just joking.
I think unlike anything I've ever felt in my life, which is...
Well, we've talked about this before, about doctors or nurses preparing you for what could happen if they see it often, but then also reassuring you that they know what to do, that this isn't unexpected for them.
Yeah.
So if the nurse had said, hey, sometimes patients have a reaction on the second one, it happens often. If so, we'll give you a bunch of medications and you'll feel better soon.
Right.
That would have gone, like you said, you would have spoken up sooner saying, hey, I think this is happening. And two, you wouldn't have been as fearful when she yells for the crash cart.
Right.
Right.
And this is how I go.
Right. You're like, okay, didn't see this.
Yeah.
I mean, I think that's something that we've talked about before, is that there is a way to tell patients what may happen without scaring them half to death.
Yeah.
And assuring them that you do see this fairly often.
Yeah.
Oh my gosh. I can't imagine what that was like.
Yeah. But other than that, everything was
I didn't have that.
Sailing.
Yeah. I didn't have that. And I will say, I mean, for the AC, it's rough, and you do have to dig yourself out, and the steroids help. But there's nothing you can really do except for wait it out. I wasn't doing, you couldn't watch TV, you couldn't really read. It was just this extreme fatigue and just this general sense of not feeling well. But it was really hard to pinpoint.
Yeah.
They do a good job, though. I mean, let's just say this. They do a good job with giving you a lot of different drugs to combat the side effects the best they can.
Yeah.
So it was nothing like I expected, but it wasn't unmanageable.
Yeah.
If you're in the middle of this, you can do this.
Yeah.
We've all done it. It's not fun, but you can do it.
Yeah.
You'll be stronger for it on the other side, I think
you get to tell these stories.
Right. Yeah. You get to go tell your war stories, sit around the campfire and tell your war stories later.
Right. Yeah.
Yeah.
Before we kind of close out this episode, let's hear from our second sponsor.
SSM Health is a proud sponsor of the Besties with Breasties podcast. 1 in 8 women will be diagnosed with breast cancer during their lifetime. Early detection is key, and keeping up to date on yearly mammograms could be life-saving. At SSM Health, we offer patients in the St. Louis area online scheduling for mammograms, including next-day appointments. Visit ssmhealth.com/schedule-mam to make your appointment now.
And we're back. So what do we want people to know about chemo?
I think you just want to educate yourself as much as you feel comfortable, and then prepare the best way that you know how. Get meals in place if you need that, kind of like we talked about last time with surgery and everything. And normalize your fears. Fears are okay, but to not over-exaggerate them, because everybody's different.
Yeah, everybody's different. It may not be near as bad as you're building it up in your mind, or it may hit you a little bit harder than you had been expecting, and both are okay. But it's certainly not the chemo of the past. Let's say that. They have come a long way in managing side effects, and you're going to make it through just fine. I agree with Sarah that you need to put resources in place. this is where you're going to really need people is during, I feel. Do you feel that way? Chemo is where you really need people.
I think so. We had set in place to get meals delivered at every chemo, and sometimes I felt way better than I had expected. So all the meals that were in place, we were like, well, I mean, we could cook just fine. It's better to over prepare than to under prepare, I say.
Well, I don't think it's so much about, hey, we made you meals because you can't drag yourself out of bed. It's the convenience factor.
Yeah.
Your life is so different, and you're running to the hospital while managing kids. And so for me, it was just more of just coming home from chemo and having a meal that we could just heat up.
Yeah.
Which just incredibly practical and very helpful.
Yeah.
So it's not necessarily like, what can they eat or how are they going to, because when I was at the height of my AC treatment, I wasn't eating anything.
Yeah.
I mean, I had no appetite, but it really made me feel good knowing that people were feeding my family.
Yeah.
You know, because I wasn't doing it.
Yeah.
As my husband was handling the kids, it really helped to have somebody bring that. So, you know, put those kind of things in place, or like Sarah said, have somebody mow your lawn, or you know, do the things that you need to do. But you're going to feel good. I mean, that's the thing. I want people to know that you're not going to be sick the entire time in between infusions.
Right.
Like for me,
life goes on like normal.
Right. You will bounce back.
Yeah.
And as you progress, you will have more and more fatigue. And I think that's what we're going to talk about next time, right?
Yeah. Yeah. We are going to talk with someone who started a whole business around fighting the fatigue when it comes to chemo.
Yeah. And both of us benefited immensely by exercise, and we're going to talk about that because fatigue is likely going to be your biggest side effect. And so next time we're going to delve into that and discuss how exercise can be your best friend when you go through this.
Yeah. Until next time, guys.
See ya.